On health issues now, and Kenya has made strides in addressing the HIV endemic that has resulted in a 68.4% reduction of new HIV infections. In a bid to ensure it doesn't reverse these gains, the Ministry of Health, through the National AIDS and STIs Control Program, that is NASCOP, has launched the Kenya HIV Prevention and Treatment Guidelines 2022 edition that aims to optimize treatment for people living with HIV in the country, among other targets. Gloria Milemo reports.
In its effort towards achieving epidemic control, Kenya has managed to reduce its burden of new HIV infections by more than half since 2010. The Ministry of Health says these new infections have reduced from 75,000 in 2013 to 32,000 in 2021. The decline has also had an impact on the national prevalence rate that was at 11% in mid-90s to 4.3% reported in 2021. A significant reduction of AIDS-related deaths has also seen the mortalities decrease from 58,446 in 2013 to 19,486 in 2021. And on mother-to-child transmission, the rate has reduced from 13.9% to 8.3% in 2021. Speaking during the celebrations of the milestones made in HIV prevention in the country, Acting Director General for Health, Dr. Patrick Omoth, attributed the success to a number of factors, including the ongoing implementation of the Kenya AIDS Strategic Framework.
Preventing new HIV infections remains the cornerstone of HIV epidemic control, and gladly, we have a Kenyan HIV prevention roadmap that is clear. If we adopt a targeted approach that considers the locations and risk profiles of the population, we will avert 1.1 million new infections and 760,000 deaths.
We have the second largest treatment program in Africa after South Africa. It's a good thing, but also it's a position that we must remember. We cannot continue growing this epidemic. We will not sustain the treatment program if we do not stem the new HIV infections.
Similarly, there has been increased access to facilities offering antiretroviral treatment in the country, from 2,006 facilities to 35,000, where over 1.2 million people living with HIV go for services. The country has also increased its male circumcision prevalence that was at 91.7% as of 2018, meaning 9 out of every 10 Kenyans at the time had undergone the procedure meant to reduce the risk of acquiring HIV. In a bid to enhance sustainability, the government is said to have increased its HIV allocations to 5.6 billion shillings. However, experts still call for more allocations to help address the epidemic effectively.
We know that the donor basket is shrinking. It will be my wish that when they are sensitizing the new governments, the new CCs and the new governors, that the funding for HIV becomes one of the top priorities in their sensitization, so that we get out of the bracket and achieve what we call journey to self-reliance.
This launch is a manifestation of what research and development can do, because the new formulas are there. So it is important and a must that the incoming government has to put in R&D financing in the budget.
To ensure it enhances HIV treatment and prevention, the ministry also launched HIV treatment and prevention policy and guidelines for the year 2022, said to be a game changer in addressing the HIV epidemic.
We are bringing into space new interventions to be able to fight HIV. Like, for example, if you take the aspect of testing, we are moving from 2-tier testing to 3-tier testing, which is going to eliminate the false positives. For a long time, people living with HIV have been on a drug called cotrimoxazole for the rest of their lives. That has changed. Now we are going to be able to have stratified administration of that medicine.
These recommendations will ensure the use of safer and newer treatment regimens that lead to treatment optimization of all people living with HIV/AIDS.
The policy and guidelines, among other things, addresses issues around nutrition with regards to infant feeding in HIV context, integration of mental health into key and vulnerable populations, and national implementation guidelines for medically assisted therapy for people on opioid use disorders, among others.
We want to have more quality and more efficient way of identifying the persons who don't know their status. The guideline also looks at better regimens for clients or ARVs to reduce the pill burden, but also to ensure that they are more efficacious. And a big win here is the use of DTG for children, which is more efficacious and less toxicity. And also other options like TAF in terms of options for treatment for clients.
Even as Kenya strives towards ending AIDS as a public health threat by 2030 in line with the Global Sustainable Development Goals, more still needs to be done to ensure the attainment of the 95-95-95 targets. Gloria Milimu, KTN News.
So now Parliament has concluded the induction of